So good afternoon. Today we'll be talking about some of the work that the Command Center is doing with some of our colleagues in the hospital community to start planning for setting up field hospitals. We're pleased to be joined by Eric Dixon, who's the CEO of UMass Memorial in Worcester, and by MEMA Director Sam Phillips. With respect to the daily update, yesterday the Department of Public Health reported 2,482 new cases. The 7-day average positivity rate is 2.9%. 98,075 tests were reported, and over 7 million tests at this point have been administered in Massachusetts. Since the spring, we've worked to expand our testing program in a pretty big way, and we now have the capacity to do at least 100,000 tests a day, and have been floating around in that vicinity on a number of days in the last few weeks. 661 individuals have COVID or in the hospital, and 151 are in the ICU. Across the nation and around the world, as we've talked about before, we've been seeing an increase in new COVID-19 cases and hospitalizations. And since Labor Day here in Massachusetts, cases have increased by 7 times, and over the same period of time, hospitalizations have increased by 2 times. Today we have about 661 individuals in the hospital, compared to about 178 on Labor Day. And the numbers clearly have been trending in the wrong direction since the end of summer. We've been talking to and working with our hospitals all the way through this exercise, dating back to last spring, and have been talking recently with them about treating an influx of COVID-19 patients. And last spring, among other things, we made the very difficult decision to have hospitals focus almost exclusively on COVID patients at the expense of almost everything else, to ensure that we had enough capacity to serve those who had COVID. And as a result, over that period of time, there were many people who put off getting routine and in some cases serious medical care, which created a secondary problem. Since then, we've been working closely with the hospitals to work to prevent having a similar kind of circumstance play out here this year, and we believe that it's possible to create the capacity that we need here in Massachusetts to treat non-COVID medical care and COVID medical care as we work our way through this surge. Hospitals are currently operating at about 73% of capacity, and ICU capacity, this is overall, is at about 50%. The hospital community is prepared to make an additional 400 beds available on their own by converting acute care beds into ICU beds. And last spring, I think as people know, we stood up about 5 field hospitals, which had a total of about 1,000 beds between them. These sites serve as space for patients needing a lower level of care so that more seriously ill patients could be treated in the hospitals. Over 700 patients were served between the sites at the DCU in Worcester and at the Boston Hope site in Boston, and 3 of those field hospitals were ultimately not used in the spring. We're announcing today that we're going to reestablish a field hospital with 240 beds at the DCU Center in Worcester. MEMA and the Command Center have activated plans to mobilize that site, and we expect it to be available for patients if needed by the first week of December. The National Guard, as they did last year, will support the setup of this facility, and UMass Memorial will serve as the clinical partner for the site, which will be staffed by professionals from their team. The Command Center and MEMA are continuing to have discussions with other hospitals and local officials to identify other locations for field hospitals if they're needed, and Sam Phillips will speak about this in a bit more detail in just a minute. We've been working with our colleagues in the hospital community for quite a while to make sure that they have every resource they need to fight the virus, but we also need everyone else to play their part in this fight. As most people know, yesterday the Commonwealth reached a tragic milestone, 10,000 confirmed COVID deaths here in the Commonwealth. This merciless virus has undoubtedly impacted practically everybody one way or another here in Massachusetts, and reaching this unfortunate milestone serves as a reminder that COVID is a complex and potentially deadly virus. We get the fact that for many people it can be mild or even invisible, which is one of the things that makes it particularly insidious. But we can all, if we have it, spread it to some others for whom it could be a life-threatening and extraordinarily dangerous illness. And that is really, in many respects, where the tragedy comes from. We've learned a lot about this virus since last spring, but we still have a long way to go. And at the end of the day, the tools we've put together only go so far. We can only set up so many extra beds. Every single person in Massachusetts needs to appreciate the significance of their role in dealing with the spread of this virus. People need to change their behavior and get serious about who they spend time with, how they act, and why Massachusetts is at risk, primarily because of a lot of the things people do when they put down their guard. And this isn't a guess or a warning. There's a growing base of evidence across the country that a big part of what's been driving the increase in cases and hospitalizations is in many respects what I would call the individual acts of many people engaged in familiar activity on a casual basis with people they're familiar with. And there have been several studies that have been done that have shown that people's social circles have actually grown since last spring, primarily as a result of people getting comfortable that the virus had receded. But the math here is pretty simple. As cases increase, hospitalizations will increase too. Now, because so many people in Massachusetts continue to wear masks in public places and when they go out, continue to socially distance, continue to do many of the right things, the rate of growth in hospitalizations has been at nowhere near the same clip as the rate of growth in cases. But the simple truth is, they're both heading in the wrong direction, and they've been heading in the wrong direction now since Labor Day. We all have a critical responsibility to understand and appreciate that we can play, as individuals, as families, a big role in reducing the spread of this virus. And people should remember to get tested. We have Stop the Spread sites across the Commonwealth. We have over 250 testing sites, and as I said earlier, we're now testing somewhere between 80 and 100,000 people a day. And the turnaround time on average is less than 2 days with respect to getting results. If you're not around members of your immediate family, and I mean your immediate family, you should wear a mask, indoors and outdoors. I know that sounds aggressive, but the simple truth is this expansion of people's social circles and this desire to get back to something like normal is a big part of what's driving case growth and ultimately hospitalizations, not just here in Massachusetts, but across the country. And in many respects, it's a big part of where the greatest opportunity we all have as individuals rests with respect to not only protecting ourselves, but protecting the people we care about. And make no mistake, this also has an impact on things like work and on things like school. And we should not forget about that as well. Go to work. Most people at work are doing all the right things. We've done thousands and thousands of inspections and surveys. Communities have done thousands more. People at work, people with customers, people with their own employees are doing the things that are recommended. They're wearing face coverings, they are distancing, there's hand sanitizers all over the place, and people generally are stepping up. Schools have proven to be relatively safe at every level, K through 12 and up through college. there were a lot of people who said that when the kids came back to school in the fall, when the kids came back to college, that would be a disaster. It wasn't. Why? Because we worked really hard with the Broad Institute and the colleges to put together testing regimens which people abided by, participated in religiously, and kids, for the most part, did the right things. In the places and spaces where we're supposed to do the right things, people are doing the right things. And it has made a big difference with respect to especially hospitalizations, but everybody has to play. And in those small moments, in those small groups, in those most familiar settings, people need to recognize and understand that the role they play here is an important one. And if you need another example, let's talk about youth hockey. It wasn't so much the actual act of playing youth hockey that created the very significant cluster across New England that came out of this. It was the 12 hours or 14 hours that adults and kids were spending at a rink, playing in round-robin tournaments, where the kids were spending far more time horsing around with each other, no offense meant to kids on that one, I had 3, than they were actually playing on the ice, and where the grown-ups were spending far more time socializing with one another in the parking lot or in the facility than they were spending actually watching their kids play. People who knew each other, familiar settings, casual behavior. And the silent spread of the virus just roared through that community. I can't emphasize enough how important it is, and I know it sounds like I'm lecturing, and I probably am, but how important it is for people to truly wrap their head around this concept that the innocent acts of small gatherings is where COVID is finding its greatest opportunity to spread. And you're probably going to hear this 3 or 4 times from me between now and Thanksgiving, too. Because if you look at what happened in Canada, and their Thanksgiving was in October, 2 weeks later, their numbers spiked for exactly the same reason. We didn't put that stay-at-home advisory in place without thinking real hard about it. We did it to send a message that if people want to have the kind of holiday season, a safe holiday season, one where businesses are open and available to have people who work there and people shop there, where supervised, organized, inspected recreational and entertainment venues are available, where our hospital system is actually managing a load that they can carry. People need to think real hard about the role they can play as individuals in helping us work our way through this. We're living in a pandemic. I know some people would prefer to think otherwise. But it's true and it's real and it's all over the country. In fact, it's all over big parts of the Western world. And I know that people are tired of dealing with COVID. Believe me, the Lieutenant Governor and I shake our heads over how much time we continue to spend on this issue. And the vast majority of people in Massachusetts, the vast majority of the time, are doing the right things. And it has made a difference. Just look at the trajectory of cases back in the spring and look at the trajectory now. It's really different. But the trajectory now is sustained and troubling. And everybody needs to step up and help ensure that we get our arms around this. We have a ton of testing capacity. We have a ton of tracing capacity. We have a ton of PPE. We've learned a lot about this thing. But we can't get from here to there without the help of everybody here in the Commonwealth. I visited a school yesterday. It's an elementary and middle school in Carlisle. It's been pretty much in person since the start of the school year. It was a reminder to me, since the first school I visited in a really long time, like probably back to before this whole thing started. But it was a vivid reminder to me of what in-person education means for kids. Younger kids with visual aids and a teacher and an aide walk in the room, very distanced, everybody wearing a mask. I did not see a kid without a mask on. And I saw hundreds of them. And they seemed completely comfortable with it. But you watch that in-person learning experience, and the first thing I'm reminded of is what we've lost on behalf of so many children in Massachusetts since this thing started last March. And why it's so important that we recognize and understand that the actions we all take have a big impact on things like whether or not these kids, all of them, get to have this kind of experience. And when you watch the interplay between a teacher and a classroom, where that teacher can look directly at every student and see who's getting it and who's not, and stop and say, do you really understand what I'm saying? And work it through with that child in the moment. It's impossible for me to imagine how you could possibly deliver on that with the same degree of success and effectiveness through some other means. And believe me, we all know how important it is for people to continue to be able to work. And I can't tell you how much mail, online and written, the Lieutenant Governor and I have both gotten from people talking about not just the fact that the work helps them pay the bills, but about how work creates purpose. And how worried they are that as these cases go up, they're going to lose their ability to continue to be able to do something that almost everybody says was so much more precious than I realized until it almost got taken away from me. I don't want to use a sports analogy because I overdo it all the time. But people need to understand that the time is now. This is real. And the more people do to take care of the business of battling COVID, not just when they're doing formal things, but when they're doing all those informal things too, the more likely we are as a Commonwealth to weather what is obviously a really significant growth in cases, hospitalizations, and all of the calamity that comes with that. And I really do hope that people take this message to heart. Because we can do a lot of things, and we will. But in the end, we need everybody to play and to up their game and to recognize that the benefits dramatically outweigh the temporary inconvenience and some of the awkwardness that comes with incorporating these very simple strategies into everything they do.